Good morning, everyone, and thank you for the invitation. I would like to thank in particular Professor Urbancic to be here and to speak at the Diabetes Awareness Day. My name is Chara Moreal. I am in the second year of my PhD in Clinical and Translational Science at the University of Udine in Italy. And my research line focuses on healthcare associated infection and how we can organize antibiotic therapy better outside the hospital in the community. Today, I will briefly present three parts of my project. Mapping how outpatient parenteral antimicrobial therapy, so meaning OPAT, is used at the national level. And the second line is to prepare a clinical trial on the subcutaneous administration of some antibiotics. And the third is to building a safer and more structured antibiotic pathways between hospital and the community based on good quality data. We can think about people with diabetes that have a higher risk of infections. OPAT means giving parenteral antibiotics, usually intravenous, outside the standard hospitalization context. So it means at home, in community facilities, or in dedicated outpatient clinics. For these patients, hospital care is often necessary. However, long hospital stays um, have clear limits. They increase the risk of new infection in the hospital, acquired in the hospital. They are expensive for the health system and they are hard for patients and families, especially if they live far from the hospital. So, to build and improve this kind of service, we need solid data at every step. We start our research with a scoping review that looks at OPAT in Italy. So far, we have identified just 20 Italian studies on OPAT. Most of these are single center, are with observational design, and come from large hospitals. The main infections treated with OPAT include especially bone and joint infections, but also skin and soft tissue, and diabetic foot infection. However, when we analyze these studies in detail, we see many differences, different indications and patients groups, different antibiotics and treatment schemes, and different level of support from community services. So why data quality is a problem? Because in everyday work, both in hospital and in community, we already collect a lot of information about diagnosis, macrobiology results, drugs and doses, hospitalizations and readmission. But often the documentation is fragmented, in particular between hospital and community. In addition, comorbidities often coded but not linked to the outcomes or to the reasons for readmission are not tracked. And finally, patient-reported outcomes are rarely collected. And this leads to three major problems. It is hard to know what really works and for whom. Second, it is very hard to compare different models of care. And third, it is hard to plan resources and to argue for changes in services. So, in my PhD program, I work with clinicians and nurses to define new strategies for patients treated with OPAT. Today, many antibiotics are given only through a vein, and this often means a central line, pumps, and a more complex care. This often means um, this type of problem to be solved. In our trial, we want to test whether some of these drugs can be given by with a subcutaneous infusions. And this could be very helpful for several reasons. Vein, Veins are often fragile and hard to assess and to maintain in out of hospital setting. In addition, subcutaneous injections can sometimes be easier to manage at home with the help of nurses and family members and so on and patients. However, we cannot change practice without strong data. And with this trial, we want to measure the therapeutic drug monitoring and how well the infection respond to treatment and how safe this route could be in terms of side effects and complication. So to close, I would like to come back to the key messages. So people with diabetes are at a high risk of serious infection and repeated hospital stays. So OPAT should be in the future with the subcutaneous administration of antibiotics and can help to build a safer bridge between hospital and home. And the strong methodology in research development is needed to guide an evidence-based improvement for the real life of the people. So thank you very much. For any information and question, do not hesitate to contact me. So thank you again and have a nice day. Goodbye.